Welcome to the Native Connections Training and Technical Assistance, Opioid Use in American Indian and Alaskan Native Communities. This is Part 2, Prevention as Intervention webinar. In a few moments, we will open the webinar in a good way. Before opening, I do have a few opening items to discuss. Today's webinar is being recorded, and recording with all documents will be available on the Native Connections website in the near future. The web address will be shared later in today's presentation for your convenience. Now allow me to introduce our team today. Like I said, my name is Barb Smutek Amin. I'm a member of the Sault Ste. Marie Tribe of Chippewa Indians, and I live in Michigan. I'm the Native Connections Communication Coordinator, and I'll be your moderator for the webinar today. We have two presenters today. It's my pleasure to introduce you to Sienna Hunter-Sujay and Dave Braveheart, who will now introduce themselves a little bit more to you. So thank you so much. Sienna, would you get us started?
Hakame, welcome. My name is Sienna. I'm an enrolled member of the Shinnecock Nation, born and raised on a reservation located on the eastern end of Long Island, New York. Prior to joining Opioid Consulting as the TA coordinator, I served as the Executive Director of Tribal Operations for the Shinnecock Nation. I also currently serve as an instructor for the New Jersey Crisis Intervention Team Center of Excellence Training Program. And I have spent over the past decade as a clinician practicing in the states of New Jersey and New York as an LCSW. So I want to thank everyone for their time today and welcome back for those who are joining us for part 2. Dave, I turn it over to you.
Well, thank you, Sienna, to everyone who joined the call. So thank you for joining us. I want to say how matakepe, machate, washte, nape, ichuzapalo. I currently live in Mankato, Minnesota, which is about 80 miles southwest of the Twin Cities. I'm a tribally enrolled member from the Pine Ridge Indian Reservation, so Oglala Lakota, but I also am Dakota Hunkpati from Crow Creek, South Dakota. And I've been doing this work as a training and technical assistance provider, granting technical assistance provider, tribal tech on the Native Connections, but also with tribal youth programs, essential capped in the field of substance abuse prevention. And I'm very blessed to be able to be part of in working alongside of many tribal communities. It is my passion. I have a wonderful family. I have 4 children, 4 grandchildren. Life is good here in Mankato, Minnesota. So welcome to this webinar.
Thank you both, Sienna and Dave. Before we get started, it is my honor and privilege to ask Ms. Connie O'Mara to open our webinar today. Connie.
Miigwech Barb, Bojo, and hello everyone. It's an honor to do the opening today. I'm Connie O'Mara. I'm a member of the Citizen Potawatomi Nation. I'm also Irish, and I work with Native Connections. Welcome to everyone who came today. We're glad you're here. I'm also a person in recovery, so when I was asked to do the opening, I thought about all the families out there dealing with this crisis, all the individuals, all the prayers that are needed. And one of the things I do in my recovery, because I'm very grateful for it, is connect with whatever I can as a resource. And one of the resources is the White Bison meditations that come out. You can sign up for those, and they come out every day, and they're very uplifting. So I'm going to read one of those for our opening today. This is Elders' Meditation of the Day for July 17th, and the first quote is Chief Dan George, who's Suquamish, and he says, "My friends, how desperately do we need to be loved and to love. Oh, my Creator, help me this day to love myself. I can't give away anything that I don't have myself. If I am to love others, then I must love myself. If I am to forgive others, then I am to forgive myself. If I am to accept others as they are, then I need to accept myself as I am. If I am not to judge others, then I need to lighten up on myself. Let me experience this power of love." So Creator, I ask you today, please help me love myself and love my neighbor. Help us all to do this, Creator. We need to look at each person today and see your light within them. If we do this, we'll always hold my brothers and sisters without guilt. So thank you, everybody. Good wishes for the webinar. I know you will enjoy it. Miigwech.
Miigwech. Thank you so much, Connie. We appreciate you starting us off in a good way. I will now turn this over to Dave, who will be reviewing today's learning objectives. Dave.
Well, thank you, Connie, for that wonderful reading and meditation, and Barbara for guiding us through this webinar. So again, let's just take a quick look at our learning objectives for today. This is what we want to accomplish. So we're planning to explore effective community interventions that we'll learn about those as the grantees share their stories, and we'll listen to the wisdom of our grantees regarding their prevention efforts in addressing opioid use in their communities. And it's our intent to also increase knowledge on effective media campaigns. There will be some flyers and examples shared throughout the webinar, so keep an eye on those. And then last but not least is to always keep an eye on how we're going to be building our capacity in terms of establishing those partnerships in the communities that help to make our work effective, and reaching to the far ends of our community. So that's our intent for our learning objectives. And again, welcome to our webinar. And I'll turn it over to Sienna to get us started. Sienna?
Thank you, Dave. Just a quick review of what we went over in part 1 of our webinar series. We did discuss our misuse, abuse, dependence, and chemical substances, looked at the prevalence of opioid use in Native communities, and we started to discuss effective interventions in addressing opioid use. But today we really look forward to being able to hear from some of your peers and them sharing their stories about what's going on in their programs, their successes and challenges. So with that, I would like to go ahead and move forward to our first grantee who will be presenting to us from Central Oklahoma American Indian Health Center. Suzanne Johnson and Wes Wilson have coordinated the Native Connections grant at Oklahoma City Indian Clinic. Both have been serving the community at the clinic for 7 years now. Suzanne is a licensed professional counselor and enjoys Oklahoma Sooners football. Wes is a member of the Absentee Shawnee tribe of Oklahoma and enjoys fishing, outdoor sports, and participating in his tribal ceremonies. So thank you, Suzanne and Wes, for joining us, and I will turn it over to you.
All right. Thank you, Sienna, so much. My name is Wes Wilson, and I just wanted to thank you guys for taking time out of your day to visit with us. We are very thankful that you've made some time, and I'm going to turn it over to Suzanne.
Thank you for having us and inviting us to be a part of this. As you can tell, our logo for our program is talk about it. It's important to be able to talk about what you're feeling, what you're going through to get help and to get healed. If you would also look closer, the word talk is made up of the suicide hotline number. So we give away several items and t-shirts and things that have this on it. So if you need the number, it's always available for you. So this is our logo that we have here for our Native Connections program.
All right. So as we move forward, I wanted to be able to show everybody a map of Oklahoma. You may know a little bit about us, but you may not. This first image is actually how it's assimilation of how all of the tribes ended up here within the Oklahoma area. A lot of tribes had a different way of getting here, but this is pretty much how everybody got here. And this next image is actually of the Oklahoma territories now. So as you can see, there are tribes located all across the state of Oklahoma. But if you look right in the middle part, there's a white part that says unassigned. Now that part right there, that is actually the present-day Oklahoma City area. So there are no real tribal jurisdictions within that area. But because of present-day time, a lot of the different tribes, they moved to the Oklahoma City area for jobs or for other things. So it would only make sense for us to be able to have a facility that would be able to take care of our Native American population here. So if you can see, there's a red star right in the middle, and that's where we are located. We are not affiliated with any tribe. We are a nonprofit. We receive some of our funding from IHS, but a lot of it comes from our ability to build the insurances, but also just through different fundraisers and private donors.
To help you understand where we are as far as opioid and how we're trying to educate our patients on our community readiness model, we were kind of surprised at our score. Our overall score was 3. And Wes and I were both surprised by this because we have been in the community doing suicide awareness, substance abuse to the community for 7 years, and to see that some of the answers, people didn't even know we were here. They didn't know that the clinic existed. So this is kind of showing you where we're starting off as far as services and what we're offering to the community and trying to educate them on the services and programs that we have with the Native Connection grant.
So I know a lot of us have seen this before, the different stages of the community readiness model. And for our score, as you've seen, we were at 3. We were that vague awareness. So basically what that meant to us was that our community knew a little bit about opioid abuse, they knew a little bit about suicide, and they knew there were services out there, but nobody really knew exactly what it was. So for Suzanne and I, when we got our numbers back, it kind of hit home because I felt like our community was doing better. I felt like, or we felt like there was more information out there, but to find out that that's kind of where we were, it kind of gave us that opportunity to be able to step back and realize exactly where we are, and gave us a really solid place to start. It's our hopes that we can continue to move forward, but we take a lot of pride in being able to work with our community and to be able to meet them where they are. So for us to be able to acknowledge and for them to be able to show that they are within that vague awareness scale, that really gives us a great opportunity for us or a great starting spot.
Some of the strengths that were named at one of our first community meetings was the pride that our community have with each other, the Oklahoma culture. We're very friendly. We help each other. They also talked about the diversity. The clinic is very diverse. We serve everyone. We also have programs that serve in the community. So that's one of the strengths that our community listed. And so some of the concerns, water broken homes. Unfortunately, what we see a lot of grandparents raising grandkids, a parent that's incarcerated, a lack of a positive male role model. That's major, some of the concerns that they have. And also loss of cultural identity. As Wes said earlier, a lot of families have moved to Oklahoma City for better jobs, education, just to improve their lives. And as a result, they are not close to their culture, their tribe. So at the Oklahoma City Indian Clinic, we serve over 200 different tribes, so it's kind of hard to touch on one certain one when we have so many to serve, but that was a concern for a lot of our patients, is their loss of cultural identity and not being connected to their culture anymore.
This was also, whenever we started doing our community meetings, we were able to really gather some really great input as far as some of our strengths and some of our concerns. So a lot of the things that we had considered some of our strengths were actually some of those concerns. One of the particular ones was a lack of positive male role models. So we were really working on, and that's one thing that we're continuing to work on, and I'll be able to show a little bit later in our presentation one of those things that we were able to do.
The way we get education and get out into the community is with our community partners. We have a great relationship with several departments in-house. We have the HPDP, which is the Health Promotion Disease Prevention. They host a lot of camps and events for kids or patients within the service age range that we serve. So we are able to go out and do educations on suicide, on substance abuse with the kids who are participating in these camps. We also partner with the DVPI, the same thing. We offer educations at some of their events. Public health, we are asked to come in, and they have a breast cancer awareness group that we go in and we offer educations as well. Local school districts, we have the Oklahoma City Public School District, which is the biggest in Oklahoma. We work with them on their culture nights, so we go in once a month and partner with them, providing educations to the parents and the the kids of the school. We also have a relationship with Putnam City Schools, as well as Western Heights and more public schools. So those are 4 huge school districts in Oklahoma that we have worked with in the past. The colleges and universities, we have a relationship with the Native American Student Association at the University of Oklahoma, as well as Oklahoma City University. We participated in their powwow this year. They allowed us to provide educations, and we had a resource booth there, so we partnered with them this year on their powwow. Surrounding tribes, Chickasaw Nation is close. We also work with Native American churches in the area. We've hosted events at churches, and they've partnered with us on several of our events and activities. We also have agencies in Oklahoma City with similar mission statements. Right now, we're working with the Oklahoma Department of Mental Health and Substance Abuse. They have a naloxone grant, and they have subcontracts with several agencies who will come out and do presentations on naloxone. So we've had 2 presentations so far. The Oklahoma Department of Mental Health and Substance Abuse came out and did an all-staff for the Oklahoma City Indian Clinic, and Catalyst is one of the subcontractors, came out and did a presentation at one of our community meetings. So those are some of the community partners that we're working with at this time.
One thing that I forgot to mention was that here, since kind of where we are located, there's a huge Native American population, and we're decently close to some tribes, but because of transportation issues and other things, one thing that we forget that we're actually the hub for the Native American population within the Oklahoma City area. So what we really want to do is we want to be that one-stop shop. We want to make sure that whenever they come in, whatever service that they need, that we're able to either provide that for them, or we want to be able to make sure that whenever they leave, that we're able to provide some type of soft handoff, so that way they're able to get whatever services that is needed. This next slide, this was actually from our last community meeting that was held back in April. Our first few meetings, we really had a really positive. We had a lot of people come out, and they were really excited about the program, and we decided that we were going to be more involved and be able to provide some more information, and we were actually able to do some of the naloxone presentations through some of our community partners. It was a great event. We were able to partner with one of the local colleges, and they gave us a space to use, but unfortunately, we didn't really have a large turnout. We didn't have what we had expected. So of course, when the event was over, Suzanne and I left with our tail between our legs. We were kind of really frustrated, but we had to go back and realize where our community rating where it was. We were at that 3. We were still within that vague awareness. So a lot of our folks, it's probably not that they didn't want to be involved, but they're just not quite ready. So we have to spend a lot of time, kind of letting them know that we are going to be here, and letting them know that there are services that are available. So at this particular community meeting, it was a really great event. It was a really great learning event for us. So I wanted to be able to show this flyer.
Okay. As I mentioned earlier, we have Turtle Camp. Turtle Camp has been at the clinic for several years. I think it's one of the longest running Native American camps that I know of. We are able to go in at Turtle Camp and offer education to the youth who attend this camp. They have it 3 times a year. They have it in the spring, the summer, and the fall. And we've always been able to utilize this camp to educate the youth and their parents on suicide awareness, substance abuse, healthy relationships, self-esteem. So this has been a great tool for us to use to get these educations out to the youth and their parents at times. So.
All right, so the next event that we want to highlight really quickly, this is our Walk for Wellness. And once a year, we kind of take a day where we just really focus on being healthy, and it's a community-wide event, so we invite everybody from the community. And if you can see, this picture right here is actually from this past one. We hosted at a local park. We get everybody moving. It's a really great event because we're able to work with some of our community partners and get them involved as well. So if you can see, I know that pictures usually talk, our pictures usually say more things than us. There it goes, sorry. So as you can see in some of the pictures on the top right, this is at the starting point. You see some of our folks at the starting line. They're getting ready to take off, and we were able to again use some of our partners. They were able to provide us a starting point. And then in the bottom right picture, you can see pictures from our health fair that actually goes on during Walk for Wellness. It's a great opportunity for our community members to come out and be involved, but also be able to learn about other programs that they might be eligible for. And then of course on the bottom left you can see there is a gentleman there with a hand drum, and what he did was he was just located at just different parts of the course, and he just kind of played. So it was a really good experience because a lot of our folks have never really heard of the drum before, so it was a really empowering event for them to be involved in. So the last thing that we're going to kind of highlight, because as I mentioned before, one of our community concerns was the lack of male role models. So this was our flyer from our event that actually just happened last week. It was our men's hand drum class, and we held it Monday through Thursday night, where the men were able to come and they actually learned about the hand drum, and they were actually able to make their own hand drum. So I have a few pictures here, as you can see. Those of you that have made them before, you know that it's a lot of work, but it was a really great experience for us, because at the very beginning of the event, we were able to kind of take a little bit of time and talk about our roles as men within the Native home, within the Native community, and how it was kind of like a dying role, because a lot of our men, you know, they're beginning to forget who they are, and they're beginning to forget how to kind of be there for their own Native community. So it was a really empowering thing, and every night before we got started, like I said, we took a few minutes just to be able to talk about some things, and towards the end of it, we were really creating like a support group, which was a really positive thing, because a lot of these men have said that they don't really have anyone to turn to, and that's definitely what we don't want to happen. And then I have a few more pictures here. As you can see, some of our participants are actually putting it together, and what I really enjoyed about this was seeing everybody actually work together. A lot of these guys came from all walks of life, and they were actually able to come together and really complete some awesome things. So this is a picture of the final product. As you can see, some of the guys got kind of fancy with some of the wrapping at the very end, but they all turned out really good. It was a really great event. And once the drums were completed, they were asked to invite their friends and families out, and those of us that knew some songs, we were able to share some of those songs, and some of us that have never even held the hand drum now, we were able to at least we were able to at least be able to participate in that and be able to experience something new. So this is our finished products here. As you can see, there's a few of us guys in there, and you may or may not notice, but this isn't a photo of everybody, because when it comes time to take this photo, there were several guys that weren't comfortable taking their photos, and I told them that's fine. You know, that's not always what this is about. The main thing is that you're able to come out and you're able to really learn a little bit about your culture and learn about who you are, because the way that we believe is that when we make these drums, they're actually living things, and these things will actually outlive us. So it's our hopes that our kids and our grandkids will be able to use these things, and we will be able to be at that point, we'll be able to share some of our culture and actually be a living cultural. So, and that concludes our small portion. Oh yeah, if you can see, I'm sorry, I'm gonna go back. Our instructor actually in the back, that is Chris Hallbear, the living legend. He was our mentor for this, and he really walked us through this, and he did a really great job as far as making sure that we were able to have everything that we needed. So that concludes Suzanne and I's portion of this presentation. We just wanted to tell everybody thank you so much for taking some time to listen to us, and this is our contact information if you would ever like to learn more about some of the services that we have. So thank you guys so much.
Thank you, Wes and Suzanne. We really appreciate you sharing with us about your community and your prevention efforts in addressing opioid use in your community. So without further ado, we'll keep moving on. We're going to move on to our next presenter. And it is my honor and privilege to introduce our next presenter from Saginaw, Chippewa, Miss Lisa Kennedy. Lisa is the Native Connections Project Coordinator of the Behavioral Health Program. She is a citizen of the Saginaw Chippewa Indian Tribe of Michigan and has proudly served her community for over 20 years. Lisa holds a master's degree in public administration from Central Michigan University. She enjoys spending time with her family, traveling, and creating traditional and contemporary woodland-style art with her partner, Adam. So without further ado, I'm going to turn it over to Lisa.
Ani, my name is Lisa. Thank you for this opportunity to share some information about the happenings in our tribal community and how it is that we're trying to address the opioid issue here locally. Today I'm going to share highlights and I want to paint a story and start from the beginning in terms of how our community took action to address this issue. So beginning in 2014, there was a lot of talk in our community at different levels about the increase in heroin abuse. And so our leadership at that time decided that they wanted to host a celebration of healing, recovery, and hope. And during this celebration, what our community did and our leadership did together was they signed a declaration for a war on drugs. In my next slide, there's actually a visual of this moment in time, and you can see in the picture, there are many members from our community that included current leadership at that time, community members, key personnel from our community celebrating this moment. The interesting thing about this actual declaration is it was actually memorialized on a birch bark scroll. And interestingly enough, the last time that type of material was used to document our history was actually in the 1700s. I shared at the bottom of this slide a link to the local newspaper, the Morning Sun, and you can access the full article that shares a lot more information about this particular initiative. So moving forward as an extension of that celebration, our tribal community took the initiative to initiate a Healing to Wellness program. That began in 2014, meant for individuals who are current substance abuse users. They are identified through legal and clinical screening. A foundational component of this program is the implementation of culture and traditional practices to promote rehabilitation in a good way. And one of the things that I would like our fellow audience members to know is that after each one of these slides, I'm actually going to share a visual aid of each one of these activities. And that's more for your reference. I think that it helps paint a picture in terms of our approach, partnerships, and also how we're doing things on not only a tribal level, but a local/state level, and also on a federal level. So moving forward, I've included a copy of the Healing to Wellness program brochure It gives a synopsis of this program. So please feel free to reference this material at a later time. So moving forward, another big initiative that our tribal community adopted in affiliation with the state of Michigan is through our Nimke Memorial Medical Center, which is an IHS affiliated facility. We started to participate through our clinic in the Michigan Automated Prescription Systems program. It's MAPS for short. And this is a prescription monitoring system. It's meant to be a tool for prescribers, pharmacy, and also for medical providers at a patient level. And it's intended to identify patients that may be improperly seeking medication. I can tell you that I sit on a committee and we review the use of these types of tools here locally, and MAPS is used 100% of the time for every prescription that is being administered through our local clinic. And the interesting part about this program is it allows our users to go out and find individuals by name and by doctor and by prescription and link and identify if there's individuals that are shopping around in different areas and with different doctors. So moving forward, I wanted to share a grassroots initiative that took place. It's actually active right now. So it's called Families Against Narcotics. It's actually an initiative that started at a state level. And our local tribal community members decided they wanted to create a chapter of this group. And really the individuals that led this initiative, they were coming from a place where they could see the impact of this epidemic and how it was altering the course of future generations, and also just how overdoses and death are just so devastating. And so many of these people are the moms, the dads, the aunties, the uncles, the families that were left behind. And they wanted, as a community, to be able to help, you know, outside of the traditional framework of programs and services. And so their mission is to stand up against addiction. I share in this next screen one of their flyers. So what they do is they host monthly forums. Those are educational opportunities where they invite speakers to come in and talk about their personal experiences, to provide education, and then they also do support groups. Moving forward, I wanted to share the link with everyone. So if you're interested in finding out more information about Families Against Narcotics, you can see that this is where there are active chapters now in the state of Michigan, but also the link to their website. In 2018, our behavioral health prevention program hosted a overdose prevention and response training. This training was presented by Harm Reduction of Michigan. We were anticipating that there would be, you know, maybe 25, 30 people registering to be a part of this presentation. And we ended up hosting this event for 75 community members and other professionals in our community. During this training, we provided overdose response kits to all attendees. This was actually held in our cultural center building, our community cultural center building. This next slide is the flyer for that actual overdose training. And again, it highlights the collaborative efforts with other entities outside of our tribal organization. Moving forward, in March of this year, we hosted a documentary viewing of a documentary, my apologies, called Chasing the Dragon, The Life of an Opiate Addict. This actual documentary was developed by the FBI and the DEA, but it's a local picture of what was happening in the state of Michigan. We had a viewing at this gathering of 142 people. That included people not only from our tribal community, people who work in this field, but people in our local community, the city of Mount Pleasant, Isabella County, and that was very well attended. We actually took the opportunity for Native Connections to promote behavioral health and mental health services by doing a service system awareness survey. And so what we did is we engaged participants, asked them to fill out a survey to determine their understanding of the types of services being offered here at Behavioral Health. We were able to we received back over 90 respondents, and that was very informational. It was twofold. One was to inform people of what it is that we do and the services we offer, but also an opportunity for us to see where we need to do a better job in promoting the support systems that we have in place here. So again, this is the flyer for Chasing the Dragon. Moving forward, in March of this year, our Tribal Council representative for Midwest Alliance of Sovereign Tribes attended their meeting, their regional meeting, and during that meeting, they passed a resolution where they declared an emergency in the Midwest region due to the opioid epidemic. I just wanted to, for those that aren't familiar, MAST represents 35 federally recognized tribes and 4 intertribal organizations in the following states: Minnesota, Wisconsin, Michigan, Indiana, and Iowa. I also provided the link to MAST website. Unfortunately, the resolution is not there right now. However, if people are interested in receiving a copy of that resolution, please feel free to email me after our presentation today, and I'll be happy to send that to everybody that's interested. So moving forward, another initiative that we did from our prevention program in May was a prescription drug drop-off. During this drug drop-off, we encouraged people to relinquish unused and expired prescriptions, over-the-counter medications, and diabetic needles. During this collection, we collected 157 pounds of prescription pills and 80 pounds of needles. So the total collection for that one-day event was over 237 pounds. The next slide is reflective of that prescription drug drop-off. And again, I felt it was important to share the flyers, the promotional flyers, because one, it really paints a picture on how it is that we collaborate, what resources we tap into. So for instance, we used our local radio stations to do live feeds throughout the day. We engaged our McGeezy economic development entity within our tribal community to donate resources so that we could provide quality giveaways. And that was a very successful event. Closing out my portion of the presentation today, in June, we hosted a Tribal Opioid Summit. We anticipated that we were going to cap registration off for this first annual summit at 350. We ended up exceeding not only that registration online, but also on site, and had over 430 plus participants for this 2-day event. I shared a link that shares the opening remarks from one of our keynote presenters. And I also wanted to let everyone know that planning is underway for a 2019 summit, and I'll be happy to share that information with everyone as it comes out. So the topics discussed during this summit included just a community response to the opioid crisis, and these were actually topics of PowerPoint presentations that were provided by the speakers at this summit. I'm not going to read them verbatim, but I'll just highlight them. We talked about long-term effects of opioid abuse, not only on the individual but family and community, human trafficking, treatment and overdose prevention initiatives taking place in the state of Michigan, traditional culture as substance abuse treatments for American Indians that center on indigenous perspectives, brain health, opioid abuse, the neuroscience of addiction, medically assisted treatment, and then just talked about practice recommendations overall, specifically with in relationship to the criminal justice system. And then the next 2 pages of my presentation are actually the event flyer for this particular initiative. And I felt it was important to share this, again, to show the collaboration that took place, but also to provide you with the resources on conference highlights, also people who did presentations for us, our keynote speakers, etc. This was an awesome event. Like I said, we had over 400 people participate. That included representatives from almost all of the federally recognized tribes in the state of Michigan, other Indian organizations within the state, and also tribal representation, I think, from Minnesota and Wisconsin. And then obviously from our local tribal level, city, county, state, and then regional federal representation. So in closing, I just want to say miigwech, and I've included my contact information in this slide. Please feel free to reach out to me, and I just want to say thank you again for this opportunity. Samapi.
I would like to introduce Mary Horsechief, who is the Native Connections Coordinator for Cherokee Nation. Mary is an internationally certified prevention specialist for the past 11 years. She has been in the service of the Cherokee Nation for 30 years, of which 25 years she has been focusing in the area of prevention. She has assisted in the development of the Community Action Network, a network of community coalitions in the Cherokee Nation. Mary has provided training and technical assistance in substance abuse prevention and building community partnerships with both tribal and non-tribal entities. Mary is a well-known artist and enjoys participating in art and cultural ceremonies and events. So I turn this over to you, Mary, and thank you for taking the time out today to share with us.
Hello, everyone. Yes, my name is Mary, and I'm going to talk to you all a little bit about some of the stuff that we've been doing at Cherokee Nation to address opiate abuse. Let me see. I think just to kind of paint a picture, I kind of got to tell a story. So, you know, probably about 15 years ago, we were in all over the place. We were in the middle of a meth crisis, and Cherokee Nation, we were just right there in it with everybody else, you know, and we were having babies born at our hospitals that were born addicted, other types of consequences affecting our families, and jails, ICW, everything. And so we looked around to try to figure out what we could do tribally, through the state and nationally. What were people doing that was having an effect, that was working? And what we found out was community coalitions were having an effect, and and that's what we decided that we could probably do. And we consequently were able to create our own prevention programs at the Cherokee Nation Behavioral Health. So to kind of help paint that picture, that's the kind of the story of how we got started. But also, I mean, prior to this, you know, we had a lot of our departments, people were doing health fairs, a little bit of this, a little bit of that, you know, of course, educating the public and maybe going to schools. We had done the youth and elder camp. We had done surveys, but we hadn't really strategically did anything close to what we're doing now. So I say all that to say this, that this is what it looks like. We have 14 counties that we serve in northeastern Oklahoma, and that's what this is on the left. And we also have partnerships that we've built there that we call the Community Action Network. Prior to our PFS grant, which I'm going to talk a little bit more about later, that stands for Partnerships for Success, we called this the Community Anti-Drug Network, which was started, like I said, to address the meth crisis. So all of those communities with the stars are active Cherokee Nation funded coalitions. Some of those coalitions were already in existence a little bit. They were addressing some health issues in their communities. What we did was we came in and basically asked them if they were willing to partner with us and provided them with capacity building training on strategic prevention framework. And so what we did was we wrote and got the Strategic Prevention Framework State Incentive Grant. And we got that, I think we got it a year before the state of Oklahoma actually got it. We were one of the first tribes to do that. And so consequently, while we were building these partnerships with our communities, we were also building them with the state of Oklahoma. And believe me, I know it can be difficult. I've heard all sorts of stories of tribal organizations working with their state. You know, we had some of those issues to overcome ourselves, and basically, you know, most of it comes out of ignorance and not seeing the win. You know, what we kind of came into with building these partnerships with the state and with the communities is that, you know, they needed us and we needed them. It's a win-win. A lot of that also is really what you need on the grassroots level too. You know, here in Oklahoma, as Wesley was stating, you know, we don't have reservations. We don't just live by ourselves. We all live together, and we're all together in these communities, all of our races, all of our different tribes. And so, you know, at the Cherokee Nation, even though we have 14 county jurisdiction, that doesn't mean everybody there is Cherokee. So what we decided to do was just that we're all going to work together. We're going to try to bring folks from different parts of the community together to address these issues. And consequently, we addressed methamphetamine. We also addressed prescription drug abuse, marijuana, and underage drinking. And the picture of Oklahoma, those are all of our regional prevention coordinators, and what that is from the state block grants. And so what we were able to do is that little portion up there in northeastern Oklahoma, that's the white, that's our area that we cover for the block grant. So I've got a little bit of data here to talk about how opioid abuse has impacted the Cherokee Nation. Data is I used to be afraid of data, and I'm not anymore. You know, it's hard to get. It can be hard to get sometimes, but you know, a lot of times this work that we do isn't easy. I just really have to say, you know, the Creator gives us things, and a lot of it comes through partnerships. So sometimes we get data from the state, and sometimes the state gets data from us. You know, like I said, it has been a win-win situation for us. But as soon as you get data, you know, it's already old, but it's very interesting to see, and it helps to identify and strategically help you with your initiatives and strategies. So that's one of the things that we've learned and that we've taught in our communities. So just to let you know, in 2015, we found out that half of the 14 counties in our jurisdiction exceeded the state death rate attributed to painkillers. We've had a lot of opioid-related deaths, and they quadrupled since the year 2000. We've had a lot of drugs distributed. I'm not going to read it to you verbatim, but we've had a lot distributed in the state of Oklahoma, in the Cherokee Nation of northeastern Oklahoma, and I'm going to talk a little bit more about that when we get to initiatives. But these are some of the things as far as what we can see happening here. Mainly we like to look at what we can find as far as the consequences to our communities, but also to our people, you know, and of course that's deaths from opioid-related overdose. We know that they doubled between 2003 and 2014, and that we also know that they outnumber deaths due to car accidents. And it's hard to identify when it comes to data as far as, like I said, we have partnership with the state of Oklahoma. We have state data, and we also have county data. But we all live together, and it's hard to pull out just tribal data. But we do know that we had 350 Cherokee citizens that died from opioid abuse. So you got to know that that number is probably low because we probably didn't identify all of them. And our families are affected. We know that our Indian child welfare cases, about 40% of them involve families that have been torn apart by opioids. You know, a big initiative with all prevention, but with, you know, prescription drugs as well as suicide, what we found out from community readiness is that sometimes folks just don't know what to do about it, you know. And so what we did to address that is the Think Smart campaign here in Oklahoma. We don't have Cherokee Nation written all over this, but it is all over Oklahoma. It's gone through Channel 6 in Tulsa, Oklahoma, and so it runs on TV, it runs on the radio, and it runs in most of the newspapers, which a lot of those are online, the Daily Oklahoman, but also the Tulsa World. And what it is it's basically commercials that have our people in it, and all of those folks that are in those commercials are actually from our communities. We did make those, and it gives people information on safe use. You know, don't share your medications, safe storage. You know, lock them up, and safe disposal. Being able to identify disposal sites within your community, permanent disposal sites, and also showing you how to dispose of them safely with things like Datura. Most of our media has gone through our community organizations, our community partners. It's just easier for them to work with their with their own newspapers, and newspapers aren't the only way, especially nowadays, to get the word out to your folks. But our community organizations, once we were able to build their capacity, were able to come up with their own media plans and public information plans on how to get the word out. There's all sorts of ways to do it, and they're really probably a lot better at it than us, so especially with their communities. So that's a big part of our partnership. We also did a 4-part series in our Cherokee Phoenix, which is our newspaper at the Cherokee Nation that we've had since the 1800s. And the 4-part series was specifically about opioid abuse. But it's not just about the problem, but it's also about solutions and some really good stories about folks that have been able to get in recovery, and also about medically assisted treatment. We have been doing that in our clinics, and we're currently not doing it because our trained providers moved on. But we will be providing some more training for our providers. We just wrote for a grant for MAT training, and I was supposed to, I need to address the lawsuit. We, as some of you may know, the Cherokee Nation is suing 6 companies for providing and filling prescription drugs prescriptions, and we're basically just telling them that they filled thousands of pills basically when they shouldn't have. That those should have been red flagged, that they should have implemented best policies, and they didn't. So we're calling them on it and basically telling them we're not putting up with it, that they endangered our citizens, and we're suing them. So there's several other tribes that are pretty much doing the same thing with a little bit of different take on it. These are some of the strategies that we've implemented, as I talked about before, about safe storage and lock boxes. The terror pouches are a way to dispose of your prescription drugs. You can just open up the pouch, add water, and put your drugs in there and throw them away, and they're no good to anybody, basically. We have done take-back events. All of our community organizations do that too. And we do promote the permanent disposal sites. Cherokee Nation has been participating in the prescription drug monitoring program since 2014. We also promote it with our community providers, and I did address the media campaigns. We're currently helping our community partners provide training for doctors on prescribing practices within each community, and we're also providing the naloxone training, like Lisa was talking about earlier, for overdose prevention and response training. This is also from one of our partners, our EMS partners at the Cherokee Nation. We provide those trainings to our first responders, and I don't know, every time we have one, it's just really a surprise, but our community members really bring them in. Every single one we've had has been over 100 people show up, and then they get the training, and of course we hand out the naloxone. And that's from the CARE grant, Restoring Life Network. These are, of course, if you guys don't know, I was asked to put in here about our medically assisted treatment application that we did. And then also there's tribal opioid response grants at samhsa.gov, grant announcements. And that's me. I just want to say thank you all for listening to me. I really appreciate everyone sharing, and it's my honor. If you guys have any questions about anything we're doing, I just want to let you know that we've worked a long time to try to build our capacity of our communities. I know I didn't mention a whole lot about culture, but we are looking at, we have done a youth and elder camp several times with our communities. We know that culture is our best prevention, and I'm really excited about possibly doing some native games and maybe even some winter games with some of our communities. And if you guys ever have any questions about what we're doing down here, just holler. That's me. Thanks. Well done.
Well, thank you, Mary. That was just very awesome. Appreciate your sharing and what's happening in your community. So Sienna and I will just kind of build some questions here because we're at that phase of our webinar. And if you do have any questions, please write those into the chat box down below, and then we'll get to your questions. And I think Wes and Suzanne and Lisa and Mary did a wonderful job in sharing what's happening in their community. So thank you so much. So I'm looking at the chat down below. I don't see anybody typing in there yet, but I do have a question for you, Wes. You mentioned, you and Suzanne mentioned your clinic there, and you called it a one-stop shop. So I was just curious what type of services are housed at your one-stop shop clinic.
All right, thank you. That's a great question. I wanted to go into a little bit more detail, but I wanted to make sure we had enough time. Here at the clinic, we are a full-service clinic. We have physicians that are available, and they do the usual family practice stuff, but we also have like optometry, we have dental, we have public health. Of course, we have behavioral health, we have a wellness center, we have physical therapy. So our real goal is that once you are here, we're able to provide all of those needs. So for instance, when you get here, if you need a flu shot, then we can make sure that you get your flu shot. But and let's say you come in and you need to talk to a pharmacist while you're here. We're going to make sure that a pharmacist is available for you. So that way all of those questions are answered. But in addition to that, whenever somebody comes into behavioral health, if they do need some help, we're going to make sure that that there is a therapist that would be available for them. So Suzanne's going to talk a little bit about integrated behavioral health really quickly.
Yes, and we also have here at the clinic integrated behavioral health, and that service has been here for over 10 years, where all patients 9 and up are screened for depression, suicide, intimate partner violence, substance abuse, and for the kids 9 to 17, bullying. So if someone scores positive on their screen, we have a integrated behavioral health clinician, or either the therapist we have here will take that call, and we will refer them or assist them to get some help immediately. So that's another service. And we do have a pharmacy on site, so if you get scripts here, you can get them filled. So that's part of our one-stop shop.
Well, thank you, Wes and Suzanne. I appreciate you providing more information about your one-stop shop clinic there. Sienna just wrote in the chat here too, in the chat box. Those downloads are available at the next box to the right of the chat. So there's all kinds of downloads there, presentations, fact sheet, outreach. So So, yeah, just help yourself to that. Go ahead and download. Any other questions here? Yeah, I was thinking about the Michigan's, they call them MAPS, the Michigan Automated Prescriptions System. I was just curious, and and I know that a lot of states participate on the PMP, the Prescription Monitoring Program. But I'm wondering too, those who are maybe close to bordering states, if states kind of partner with one another in sharing information, or if it's a statewide or a national-wide monitoring system, so that folks who might venture into neighboring states to try to get prescription drugs from another pharmacy or a doctor. Do you have an answer for that, Lisa?
You know, that's a really good question, and I don't have the answer for that, but I can find out and definitely share that with you, and then you can forward that on to the participants in today's webinar.
Yeah, my mind works. The way my mind works sometimes is, there's always a workaround.
Well, and I do think that they are getting ready to transition from MAPS at the state level to that PMP, but I don't want to be quoted on that. So
right.
I do remember seeing something about that. So maybe that's part of the answer to your question.
Right. Seems like I would know that, but
Dave, if I can jump in on that.
Sure.
What I do know about the PMP in Oklahoma is that they can, I know that the law enforcement can check if something pops up, that they can do cross state lines and check. I'm not sure about providers though.
Ah, okay. That's good to know. Any other questions from the audience? I know we ran over a little bit of time here.
Dave, I see a question in the chat box there.
Oh, sure.
From Cindy Nation.
Oh, okay. So maybe it's a comment. Did I miss it? So, Bazi, I think I'm not sure, Cindy, I'm sorry, to all the presenters. Thank you for sharing your programs. My heart breaks for your losses. We'll keep you in my prayers. Yeah, opioid use and misuse is really a huge problem in our tribal community. So I think every one of us can probably relate to, the losses and the struggles that families go through. And I was struck by some of the data that was shared regarding, ICWA getting involved, where, a lot of cases that they were seeing where 40% was a result of opioid use in the family. So that's a pretty staggering number. I know I've asked our audience to step up there for asking any questions. Any other questions or comments from our presenters or facilitators or anybody that's on there, or our host as well? Okay.
Well, Sienna, I just wanted to say tabutne to everyone for their time today. And thank you for Wes, Suzanne, Lisa, and Mary for sharing the information in your communities, because it was just really helpful for me to learn about what's happening in other areas. And I hope that some of the questions that we had from the first webinar were answered in some of the presentations, because I know people had questions about partnerships and different community activities and programming, and I think there was a wealth of knowledge that was shared today, and that's all we could ever ask for is the sharing of this knowledge. So just tabut nay to everyone.
Thank you.
Yeah, you're welcome. And so I think we'll pass a baton on to you, Barb.
Thank you so much, Dave.
Wait a minute.
Did you want to go over a few resources first?
Yes, yeah. So yeah, this was my slide here. So I jumped the gun a little bit, but at least I didn't bail ship. So there's a ton of resources out there, and perhaps some of you have ventured to these sites for resources on opioid use, misuse, abuse. And I know we shared this on our Part 1 webinar, but we wanted to put them back up there. But we did add, and I think maybe perhaps some of you are aware of CAP Center for the Application of Prevention Technologies. They have a ton of information up there on SAMHSA's website there. So there's a hot button there with the link there to the site there, and there's just a lot of great information. I've visited that site and have downloaded some of that information per some of the other grantees' requests. So yeah, just cruise the internet. There's a lots of good information up there. So yeah, there you go. And there's some downloads here, the PowerPoints, as well as some other fact sheets. So feel free to help us out to those. All right. And so with that, I think I am ready to pass it on to you, Barb.
Thank you so much, Dave, and thank you for sharing those great resources. This is going to be very brief, but just a few upcoming webinars for everyone. Just sort of a save the date on July 24th, we do have the Culture is Prevention webinar. And then on August 14th, we have Youth Empowerment and the Impact of Social Media. All of the webinars are from 2 to 3 p.m. Eastern Standard Time. We will be sending out reminders via email and also emails for how to register for each webinar. So please keep an eye on your email for those. And if you have any questions, feel free to reach out to your grantee technical assistant. Now, again, thank you so much for all taking the time to participate in today's webinar. Like I have in a few previous webinars, I do want to remind everyone that a survey will automatically open after today's presentation. And we are definitely hoping everyone will provide feedback for today's webinar. We have been doing a gift card drawing after every single webinar for the people who complete the feedback form. If you've already won once, you can win again. We collect feedback for each webinar to help us improve our webinars, ensure we're meeting all of your needs and meeting SAMHSA's expectations. So it's really our way to say please and thank you. Survey results are confidential and results will remain anonymous. With that in mind, the only way we can enter you in the gift card drawing is for you to provide your email address. So after the webinar ends and the window automatically opens, the first question will ask for your email. Please provide that, and we will be notifying the winner of the $25 gift card via email, via the email address provided. You do not have to provide your email if you wish to remain anonymous, but please fill out the form so that way we can get your feedback, but it's not mandated that you give us your email. We just want to have a great gift card drawing to award somebody for taking the time to give us great feedback. Or any feedback. It doesn't have to be great. Okay. If for some reason the survey does not automatically open, or if you have multiple people participating using one computer, please contact your grantee technical assistant to receive a link to enter the drawing and complete the feedback form. And so thank you all so much for your time. Again, here are Here's the contact information for Dave and Sienna today. We have their email addresses and their phone numbers, and we also have the website for the Native Connections, the Samson Native Connections page, where you can go there and find lots of additional resources, including this webinar recording, which will be uploaded there. So please reach out to them should you have any questions. And everyone, thank you so much for joining, and have a great day. Thank you so much.